You all set to be on the spot here this morning?
Oh yeah, I'm ready for it.
Ready for it. You look like you take us all on, all right? Well, what should I know? Give me a good, quick education here, please.
Well, I think you might be a little better suited to do that.
Well, he has said some things to us.
Okay. Well, I'm been real down a lot lately, past, say, 3 months. Lost a lot of weight.
You lost weight?
I lost about 12 pounds, 10 or 12 pounds, and appetite's not real constant. A couple of days I'll be ravenous, and then I won't want anything for a while. Just a real despondent feeling, a lot. Not much interest in much of anything. Drop in performance in school. I think that's about it.
You
I'm having a more or less constant headache for the past week, too.
Really? You really don't feel good.
That's basically it, yeah.
Can you get out of bed in the morning?
Yeah, that's usually not a problem.
It isn't. You don't have to just push yourself out of bed.
I don't like it, but
You do it.
I do it anyway.
You're a man who can make yourself do a lot of things, right? Even if you don't particularly want to do them, right?
Usually, yeah.
You don't have trouble completing things, right?
I didn't used to. That's become a more significant problem in the past couple of months. Things aren't getting done as fast, and some things just aren't getting done.
Can you sleep well at all, or are you interrupted by bad dreams?
A couple of bad dreams, but none that wake me up. So,
any that keep coming back? Did you have any regular dreams?
not really, no.
Nothing that you
Nothing repeats.
remember clearly.
No, just I remember a couple of them that just leave me with a sense of panic, like sort of a sense of urgency. But none that repeated.
And you had no real inkling that this sort of thing was coming on.
No, it just came on about October. I didn't foresee it.
You're not in love.
No, sir.
That does a job on people, I'll tell you. That can explain just about anything. But you're not really wild about somebody at this point.
No, I already got her.
You got her.
I already got her. I'm not chasing after anybody.
But you found somebody you really like.
I have, yes.
You make that sound very serious.
Well, I'm glad I got her. I appreciate what I have.
This is the biggest one you've had? I mean, the most important one you've found?
Yeah, that's fair to say. Yeah,
It is.
yeah, it's gone on about 5 months.
About 5 months.
Yeah, which is the longest I ever stayed in one place before.
She may be very serious too.
I think she may be. Yeah.
Maybe more serious than you are. I don't know.
I don't know either.
And that goes back before your injury.
Yeah, maybe a week prior. It was homecoming weekend that I got banged up, which is a great excuse not to go to the dance.
But you and she were already pretty thick before that.
Just starting out around that.
Just starting out.
Yeah.
As I say, you make it sound serious. Now maybe that's because that's just your style. I don't know whether that's true or not.
Well, I'm not trying to indicate that this is some real heavy thing that's
going to be the end of your relationship.
Right.
But the most serious one that you've encountered so far. Right. So there's a lot going on in your life, isn't there? But that may always have been true. You may have always been very much engaged with things.
Yes, that's true. That's true.
You've never been a slouch.
Not the past couple of months, no.
You say not until the...
Not until the past couple of months, no.
Well, maybe you're due for some kind of rest. Think so?
Well, maybe, but...
Doesn't feel like that, though.
Doesn't feel like it. I mean, I just took a 2-month rest last June.
When you had your injury?
No, it's summer break.
Summer break. Did you get a real rest?
I thought I did. I thought I did anyway, yeah.
How many books did you write during that?
Didn't write any.
Not any books.
Didn't read any then. Yeah.
Didn't even read any. But I imagine you kept pretty busy, though.
Yeah, I had a job.
You had a job?
Got myself a job. Yeah.
May I ask what you did?
Made myself a job. A friend of mine and I got together and did some shoreline reconstruction and de-landscaping mostly. Built walls and that.
Is that so? You designed that work yourself?
Yeah, we decided that, and we were making more and had better job conditions than we would working at McDonald's or Hardee's or anything like that.
But you would you explain? I'm very interested in that. You work shoreline? You mean on the big lake or something?
Yeah, the residential shorelines packed with basketball-sized rocks, like that, packed into peat moss. And in the winter, the ice expands and tears the peat moss up, and then lets the rocks slide into the water.
I see.
So we come in there and put the rocks back up on the shore, and then repack them in.
I see. And you'd go right along the shore with these private homes there.
Right.
And you'd come in and you'd say, look, if you like those rocks put back, you give us so much, right?
Right.
And most of the time they'd be glad to have you do it.
Yeah, a couple of them said I'll do it myself.
Yeah.
But and we did some tennis court cleaning too. Cleaned up some tennis courts and tore out some hedges and cleared some man's back lawn. Wanted to put a garden in.
And the two of you invented this company yourselves.
Right.
And that's heavy work.
Yeah, but I enjoyed it.
No, I don't mean you didn't enjoy it, but it was you probably worked 6 to 8 hours a day.
4 hours.
4 hours a day.
Yeah.
But you were lifting these basketballs, right?
Yeah.
And they weren't full of air.
No, they weren't.
They weren't full of air. No.
They weren't.
Well, good for you. Thank God. You put some of that money in the bank too. How's that for a guess?
Yeah, a little bit of it did go into a college fund. Most of it, though, either went back into the company for tools or other equipment, and then most of it just went back to the stores.
But you really have a company. I mean, so that you've really got some capital equity now in this equipment.
Oh,
so
yeah.
the two of you.
Yeah, there is an investment in there.
And you plan to do this again next summer?
Right. Yeah, we're gonna see if we can get some other people involved in it too.
So not only have you got yourself a serious girlfriend, but you got yourself a serious company, huh?
Yeah, that's true.
And you're now 16, 17, 50, what are you?
15.
15? You're not letting any grass grow under your feet, are you?
Not in that area, no.
Yeah. Well, that's quite something. What? You come from a long line of earth movers?
Yeah, and my grandpa was was unbelievable earth mover. He was, at one time for a period, I think about 6 years, he was mayor, chairman of the hospital board, chairman of the school board, ran his own heating and cooling company.
You're kidding.
And a horse ranch, all at the same time.
May I ask where that was?
That was in Cuba City, Wisconsin.
I see. Is he still alive?
Sort of.
Sort of.
He's had a couple of strokes, and he's not.
But
he's a
he's
vegetable.
an old man now.
Yeah. He doesn't. He has trouble recognizing his own kids sometimes.
Is your mother or your father's father?
This is my dad's father.
Dad's father. I see. So is he the great patriarch of the clan?
Yeah, he was really a hard driver. And my dad picked up on that. And he doesn't let any grass grow under his feet either.
The old man doesn't either.
No, he's more than serious about what he does.
More than serious?
Oh, yeah.
Does he want to be on the Supreme Court of Wisconsin? What's he shooting for anyway?
No, he doesn't want to go to any bench position until he's ready to retire. Maybe. Then maybe. But I think he enjoys what he does.
He's a lawyer?
Yeah.
May I ask what kind of law he practices?
Business law.
Business
mostly.
law, I see.
A little family law, but mostly business law.
Business law, I see. So you come from quite a line of these movers.
Yeah, that's true.
You look like them too?
A little bit.
A little bit.
A little bit.
I see. Well, my oh my, it tires me a little bit to hear about it. Yes, indeed. Well, congratulations. You think you're going to be a lawyer yourself? You're going to be a businessman? Or you don't have to answer that. You don't even know yet.
I really don't know. But I thought,
you could go into politics. Your grandfather was in politics too, right?
Yeah, he was. People did like him. He was. He had panache. I thought I wanted to be a doctor for a while, but I don't know if that's a realistic thought anymore. I really don't know what I'd like to do.
Why? Maybe you got disgusted with all the doctors. I don't know, you've been seeing enough of them lately, right?
Yeah, I've seen quite a few of them. But,
that might have cured you of your ambition, seeing all these doctors.
I don't know if I have the mettle to make it through.
The mettle?
Yes.
I see. What particular mettle did you think you were lacking anyway?
Well, I don't know. Whether or not I was intelligent enough to make it through, or had the diligence to get through. Intelligence mostly, and
something made you wonder about your intelligence.
and our performance. The performance last year was just top notch. I think I won out with a 3.93 or something at the end of the last year. This year's just not going so well. And
Well, you haven't been feeling very well either, man.
well, yeah, that's true. That kind of builds too. It's kind of a snowball effect. The worse that I feel, the more despondent that I am. The worse I do. The worse I do, the worse I feel. And it just keeps going like that. I don't know, and I seen the biggest slip come in the most important areas in
Sciences and
science and math. Just aren't coming as easy as they used to, and I'm just not understanding the material quite as well. I don't know if I can make it through medical school.
You may have had other reasons for wondering about doctors. I don't know whether there's a malpractice crisis in Wisconsin. There is where I come from.
Yeah, their doctors are awful careful around here. A lot of defensive medicine.
Your father may talk something about that too, from the law's point of view. Right?
He hasn't really mentioned that.
He hasn't.
No, he hasn't talked about that. I mean, I know quite a few doctors, and I see the work that they do, and just and it just really impresses me, and I know that it impresses other people. You know, and I see the satisfaction that so many of them get from doing their jobs well. You know, that's what I want to do. I want to get that kind of satisfaction, arouse that same kind of respect in others and in myself.
How about that?
But I don't know if I can do that or not.
You don't know that you can do it?
Yeah, I don't know if I can. You know, it's a long road to hoe.
Sure.
And, I just don't know if I have the mettle to do that.
Well, on top of that, you might be thinking you want to settle down and have a family and see your kids and, you know, and to get to know your neighbors. Who knows what other things might be in your mind?
I haven't really thought about that. So much settling down and things. No, I really haven't given much thought to that. I mean, I've thought about...
You think about a lot of things. I'd be surprised you didn't think about that.
Well, I thought about the way I'd like it to be, but I haven't thought about where or what these people that I would be settling down with would be like.
I know, but you know what I mean. You know what price people have to pay for the kind of success that you're talking about.
Right.
You know, you see it everywhere that it takes a lot out of a person. And it means a lot of things they can't do as well as what they can do, right?
Yes.
Maybe this young lady that you're fond of got you thinking about being a family man. I don't know.
No, I don't think she's succeeded in that.
She hasn't succeeded in doing that yet.
No. I mean,
some women can have a powerful effect in that direction.
Yeah, I understand that. A friend of mine just got married in November. November. And he, let me tell you, boy, he was going to the moon before he met this girl.
You're kidding?
Yeah, now he's not so interested in going to the moon anymore. He
stays home.
Yeah, he's content to sit at home. He had this grand plan of ascension through the federal government.
This isn't your partner in the earth?
No. And he had a job, and he's got a job in something with the budget, federal budget. Not quite sure exactly what he does, but he was going to get this job and do this for a while, and that was going to take him up here. You know,
sure.
Pretty soon he was going to be sitting on top of the heap.
Right.
He's decided, maybe he'll just stay in the budget department for a while.
That's a big change.
Yeah, I don't know. He did change his plan of action quite a bit.
Guys, he may be about to have a passel of kids. Who knows what he's going to do?
I don't know. I wouldn't be surprised.
Yeah. Just some of these women will rope a man right down, you know.
Yeah, I've seen examples of that.
You've seen examples of that?
I've seen examples of that too.
Right. Well, I'm sorry it's not a happier time in your life.
I'd like to be feeling a little better.
Sure, well, I hope you do feel better before too long anyway.
Yeah.
I don't think you're going to jump off the 15th floor of a building now.
Probably not, no.
You didn't look like the kind who would do that to me.
I've known a couple of people that have done that.
You have known some of them.
Yeah.
Yeah. Schoolmates of yours?
Yeah, the past month or two, is that right? About a month or two?
Yeah.
Two of the people in my class.
In your high school class?
Yeah, high school class have punched their own tickets.
Is that so? That's a shocker, isn't it?
I knew one of the guys real well.
You did?
And played football with him.
Huh.
And the second guy I had acquaintances with didn't know him as well.
But one of these fellows was a friend of yours?
Yeah, I knew him pretty well.
Hmm.
Tutored him in Spanish as well.
Is that so?
Yeah.
Huh. So he was a student of yours?
Something like that, yeah.
And this came as a surprise?
Yeah, he gave no indication that he was contemplating that. He just, one day he came to school, paid off all his debts.
Is that right?
Yeah.
Gives you a scare, doesn't it?
That's all it did, though. Came to his homeroom, sat down for 10 minutes, went off, paid off all his debts, and then went. I'm not sure where he went after that, but he wound out home about 3 o'clock and shot himself.
Honorable man, too, wasn't
Yeah, he was a smart guy.
he? He was a smart guy.
Yeah, he really had a knack for the books. He was a smart guy, and he's a hard worker too.
He took instruction well in Spanish?
Yeah, he did. He was having quite a bit of trouble in the beginning of the year, and he really worked at it. Got that turned around by mid-semester.
And nobody knows even now what was going on.
Well, there's something, he left a note, and there's something in it I didn't ever find out exactly what it said, but there's a reference to not being accepted. And not being accepted, not being appreciated or cared for and all that. Let me tell you, for a guy who wasn't accepted, there were a lot of folks in that funeral home.
Yeah. You liked him yourself? You accepted him?
Yeah, I liked him.
Yep. Oh, that's a terrible tragedy, isn't it?
Didn't see too much of him this year outside of the season, but in practice, but I still liked him quite a bit.
But you don't predict such a fate for yourself?
No, I don't think so.
Hope not.
No.
Certainly hope not. Yeah, I don't know you very well, but I can already hope not that.
No, I think that's a little, extreme.
Well, it's very extreme, but as you pointed out to us, it happens.
Yeah, it does.
Oh, it does happen. Well, one thing I'm very impressed by, beside your accomplishments, is the amount of life that you've encountered in the short space of years that you've had so far, right?
Yeah, I have encountered quite a bit of it.
Yeah, you really have. Events in high school, your friends, watching people get married and the effects on them, running a business, finding a lady friend, teaching, planning your own life, wondering what you want to be. All kinds of things going on in that head of yours, good heavens.
Yeah, it is. It does get busy up there sometimes.
It's busy up there. Yeah. Well, whatever you decide to do, whether you're going to set the world on fire, you're like your granddaddy, or whether you have a wonderful family or an interesting life, whatever you do. I bet it's going to be interesting, whatever it is.
I hope so.
Yeah.
I hope so.
Yeah. I hope you have the freedom to design it the way you want it, whatever fits your wonderful nature. Yeah. Hope that for you.
Well, thank you.
Nice to meet you. Privilege.
Nice meeting you.
Good.
Thank you.
Take care now.
You too.
Hope you feel better soon. He's a formidable young man, isn't he?
Yeah.
I was wondering more about mood.
He's also, he's a lot going on in that head that you don't know about.
Yes.
But, he's a very thoughtful young man, impressive person in a lot of ways. It's so easy to make too much of details in these things. I think he says this starts when his girlfriend gets involved. His girlfriend did it, but I don't know. But he's got some, looks like he has, well, you tell me what. You watched it when I talk all the time here. You talk about it.
The striking thing was the language used. Again, being videotaped, you can't get a feeling of what it felt like to interact with. But the language sounded like 25 or 45 or something.
How about that word panache?
Yeah.
Like that?
Well, he used many phrases that sounded like what my father would use. I kept wondering, are you talking to his dad right now? It's not him.
Absolutely, maybe that was one of Bill's convictions, that we're talking to his dad.
He also struck me as trying to be incredibly stoic. I thought he probably wasn't in touch with a lot of his feelings. And he just hardly moved his face at all. He was trying to be this picture of a very stoic man.
But he wasn't afraid to speak about his sadness and that he wasn't able to do a thing as much before. I agree with that. But at the same time, there's a kind of balance in him that shows up. He's not just a denier. He's not a simple person. Complicated young man.
Oh yeah, I think he is, and he's hard to know what goes on inside him. He's slow to, he comes to the appointments, and I think I see some of him, but I think he's quite complicated. Lots of conflicting wishes and attitudes within.
One of the conflicts I thought that he autonomically demonstrated was his feelings about this young lady. He quite blushed as he talked about her. And it was interesting to see it come across such a granite face. But it was distinctly there.
Did he talk more about the suicides when they happened?
A little bit, yeah, especially about the one boy he tutored about a month ago.
When did that take place?
There were 2 suicides about a month ago.
January.
Yeah.
What's going on over there? That's an interesting matter. You know, these things are so often epidemic.
Yeah, it's slow. There hasn't been one in 3 weeks. Maybe that's progress for
Is
our local.
there a problem with the administration?
Just the adolescent suicide rate has gone up a lot in the last 20 years, and it hits home. It happens here. Both were gun deaths. 2 young men used their father's gun, as I understand. From what I know of the cases, they're considerably different than his background in psychology.
I remember you were describing this high school as being one of the most competitive high schools in the state.
Yeah, not in the world. Yeah.
You may be pushing the kids very hard.
I
don't
think,
say that
yeah.
explains it, but it may be one of those factors that adds up.
I would think so, yeah. Or everybody's trying hard to make it and failing to one degree or another.
Part of the administration attitude, and I don't know how it reflects back on, is that there's nothing wrong here. Even after the first death, that there was some attempt by some people at least to pretend that nothing really happened.
There's a death 2 years ago, there was suicide 2 years ago, a young woman, young girl, another gun death.
A woman killed herself with a gun?
Yeah, 14 or 15.
Bill, what happens if you basically sort of posit this as a normative phenomenon for this kid, and that the real problem is he's trying to leapfrog a normal developmental stage? I mean, it doesn't seem unusual for a kid to wonder who he is and where he's going.
Yeah, there's, I think, large elements of that. But there's also considerable depression, too, and sense of frustration. I mean, are you wondering, is this within the, how much of this is within the realm of normal and how much is beyond it? Or?
Well, I'm wondering if the problem isn't not his sense of the problem is really that he's trying not to be a year-old. Girls don't know who that is. I didn't know where I was when I was.
He doesn't, yeah, in other ways he'll show it, like doing passive-aggressive things with his dad. He made a very strong request for medication for an antidepressant, which he's on, but I have doubts that he takes it because the blood levels, or he takes it at his own pace, because the blood levels are far removed from the dose he takes daily. That could be a metabolic thing. So there are adolescent properties, rebellious, they're kind of quiet in him, or threatening his parents. He said, you know, I told my mother I was going to go in the Marine Corps at 17, and she almost wet in her pants. A real glee about that. You know, this would be the one thing that would drive her nuts. Yeah, so you see it. It's not all.
This kid yet?
Huh? Yeah.
Well, it must be a relief to you to hear it. Right?
Yeah.
Are the parents surprised with how non-immature appearing he is? And do they say, geez, you know, the kid doesn't talk about cars and girls and kind of frivolous things?
Father's worldview is rather grim, and it's hard work, and I think Mother is more in tune with his emotional life and his developmental needs. Father is not. What was your grade on the biology test? Checking it out, it was 94.
Gotta do better.
Well, Father was satisfied with that, but Father, I don't think, treasures youth or spontaneity much. Something to be outgrown. Mother seems to have more of a feel for it.
Well, that grandfather sounded like a wonderful man.
Yeah, real patriarch.
This might be-
And either the kids were successes like his dad or failures compared to the old man.
Well, compared to the old man, we're all
Slouches.
slouches.
Bill, when you see the five of them together, does anyone ever play with anybody else? Does he play with this 6-year-old and Tim?
No, he's rather, they're very mature too, the kids. They sit there between mom and dad very quietly and doesn't pay them much heed. He teases them a lot at home, and the parents get irritated that he sort of vents his frustrations on the little ones, as you might guess. But he doesn't relate much to the little kids.
Not play.
No, he's there. I think he sees them as a bother in his life, and
Well, he certainly is a prodigious worker, isn't he? That description of the company he founded was...
yeah, he gets up at 7. No, he starts work at 7. I think goes from 7 to 12. And he's started this at age 15 or 14.
And he's already made capital investment in his equipment.
You know, it's interesting because, I mean, you're talking about this kid sort of
Social Security for his
not being playful, but, you know, growing up in a small, rural, Midwestern farm town, he didn't seem unusual to me. As unusual to me as it sounds like he seems to many other people here. I think there is some cultural stuff where, at least, you know, his father probably grew up with a lot of people who didn't finish high school. And whose parents went into farming like at age 14 or 15. So I don't know. I mean, I think there's a sort of subculture that Cuba City
Maybe
might
so.
have, which is more like where I grew up, which is you're an adult when you're 14 or 15. You're out plowing the fields and doing the farm work, and you're kind of one of the men at that age.
This is the American West, isn't it?
Well, at least there's a subject of that,
People
yeah.
have made this country great, right? Lately, the Japanese behavior fits the wheel out West.
It seems he can only allow himself a very private despair, but despair there is can only be suffered alone. I mean, the use of the word metal.
Yeah, the stoicism.
I had wondered, as you obviously could see, that I wondered whether he had fallen in love. And behind the granite mask, he was really kind of, in his strange way, sort of wild about this girl, and maybe she about him, and that this really threw a monkey wrench into his plans, because he was going to see much of her. And young people at that age, everybody, when they're really in love, want to see a lot of each other. And how's he going to do that and have 26 other hours in his day? I don't know.
Maybe.
I mean,
He's not it's interesting, he downplays it, he's not spoken much of it.
But the timing,
Yeah,
just before his big accident, is suggestive that it may just be. And then did you hear his remark about how that meant he couldn't go to the
So an excuse not to go to the
excuse to go to the prom? So there may be other inhibitions involved in that as well.
Did you get, I couldn't tell again with TV, whether you got much response to your last move from your wish for freedom to pursue whatever he wants and your admiration of his nature as a person. Did you get no light?
Not particularly. I didn't see particularly anything that you, Bill, didn't see any great. He didn't relax and tell me that he was going to think it all over again. No, but I didn't expect anything to happen.
Not glimmers even. Because he seemed slow. He seemed encased while you're talking to him. And I kept wondering if you're admiring of his abilities and then finally rendering your opinion of sorts that, gee, I hope things go well for you and I hope you pursue what you want. He didn't brighten to that kind of...
Well, he's not a volatile character. I mean, he's not like you. Except for you said expect him to respond very much to anything. I mean, I was surprised that he blushed when he did. I mean, that was a more age-appropriate thing for him to do than most of the things he did, I thought.
He's also a kid in a way that's kind of a victim of the culture of experts. He needs to get A's on all of his tests and have a business at 15 and present a good front to the psychiatrists and not disappoint his father. It's quite amazing for a 15-year-old to come into a setting like this. And
He's excited about the opportunity.
Yeah.
Come in.
Yeah, took it. I didn't think he'd take the bait, but...
Tell this guy's from Harvard.
Great job. Good father.
A button-down drop-cloth shirt on?
Yeah.
Yeah. I mean, I haven't seen a 15-year-old in one of those. I should walk all the way.
25 years ago.
It's the inverse of these guys we see over on 2A that we say, look, if you don't want to be treated like a bum, get a haircut. Should tell this guy to get an orange streak in his hair and relax. Behavioral intervention.
The thing that's puzzled me about the increasing adolescent suicides, in some ways it makes sense that it would happen at West High School. I went to a high school where 75% of the students went on to college, and it was a public high school, but we had the most National Merit Scholars and finalists of any high school in the whole Dallas area, except for one private Episcopal church-based school. And there was a lot of pressure. I mean, it wasn't unusual for me or my friends. When I stayed in Latin, one thing I did hear from my parents was, well, last week you were only a runner-up in the state science competition, and that was a real typical thing. But no one in our high school committed suicide. We all tried really hard, and everyone worked really hard. And you were supposed to know what you were going to be in the 7th grade because you could start taking high school courses in the 7th grade. But people didn't commit suicide. And I wonder what it is. I mean, I think there's always been that subculture. I mean, I'm old enough to be this kid's mother. I'm 18 years older than he is. And I just wonder if you have any sense of why or you, Bill, have any sense of why adolescents are committing suicide now?
I think they always have, haven't they?
Yeah.
I don't think that, maybe there's been an increase, there's been a claim there's an increase, but the suicide statistics are the most unreliable things in the world. I learned that when I was a pathologist assistant going through medical school. I used to assist old Dr. Brandis down at the Southampton Hospital on Long Island. Brandis was the chief pathologist at the Roosevelt Hospital, which is a very, very fine hospital in New York City. And we'd come down there in the summer and dig around with the locals. I was his assistant, and we had some splendid suicides. And they always were sent out on, MI or a stroke or something of that kind. One day a man came in and he'd been cleaning his gun, because the story was, and in the course of cleaning his gun, he put the funny way to clean it. I guess he must have wanted to clean it with his tongue, because he put the end of it in his mouth, and then by accident he pushed the triggers down, and of course there happened to be two shotgun shells in it, so it blew the top of his head off. Now that's an unusual lesion in a stroke or a heart attack. So I said to Dr.
Blood pressure's real high.
Real high, right? So I said to Dr. Brandis, I said, now Brandis, how are you gonna call this for a stroke anyway? And his head is all over the ceiling. And Havens, he said, you're never gonna be a doctor. You're too dumb, he said. I don't understand how these things work. And then he explained to me how he was gonna talk to the press and fill out the death certificate. But Jesus, that's what happened. A guy was never discussed as a suicidal. So.
Well, we had 5,000 students, and in 4 years, no one had a death. One guy died out running in football.
Well, I'm not questioning your facts, but years ago, I was responsible for reviewing all the suicides at the Massachusetts Mental Health Center. And the official statement at the Massachusetts Mental Health Center was that there was 0.5 suicides each year, which meant there was supposed to be one every 2 years. And I said I thought that was probably weird. So I made a careful study of of samples of the patients from each year, and we could get it up to 7.0 a year.
Within the house or out?
Well, within 3 months in the house and within 3 months. We get it up to 7 when you looked. Because the bulk of suicides occur and nobody gives a damn. They're so sick of the patient, they're tired, they don't want to hear any more about it, and they just slip away in the night. And you gotta look hard. Now, I don't mean that's true at your place. What made me so suspicious of every suicide I ever saw. Anyway, that's not right.
It's hard to know.
I didn't feel this man was suicidal. I investigated that problem. I didn't think he might.
Some people feel the vulnerability factors for adolescents have increased, like a tremendous influx of drugs, because it does seem that kids at risk, drug-abusing adolescents, especially males, are at risk to commit suicide. They're not the group you would traditionally think. Also, kids in trouble with the law, young males in trouble with the law, with drug problems, alienated from their families, are at high risk. So there may be... And people talk about the breakdown of the family is no longer supportive enough. They're increasing vulnerability. I think it probably has gone up some. I'm sure case detection is better too.
I would be curious to your opinion, Bill, you talked about it a little bit before we talked about that publicizing suicides, identifying and publicizing them may lead to more. And that some people, there have been articles in the literature.
Well, there have been several studies on whether those things make any difference or not. The findings are very problematic. Women are the ones who are supposed to be more susceptible to those things. Have you heard those rumors?
Yeah, that's what they...
I wasn't going to mention that, but...
Give a contagion effect.
Hysterical contagions. But I don't know whether that really results in suicide or just dramatic congestion. Well, he's a prodigious young man. Excuse me?
I was just wanted to go back to John's comment about, whether trying to get the family to accept this as being somewhat normative. Even his depression it seems like it allows the family to say, well, he should be able to kind of, keep plowing along at this rate, and that it's not that his expectations are too high or that their expectations are too high, it's that he's depressed now and not able to meet them.
I think they understand some of that. I mean, the idea that father and son will clash, and that mother seems to grasp it. That's part of establishing independence. It's hard, and father understands it to some degree. But spitefully and quietly, and try to break that up. Father tries to hammer on him to improve him and get him, get him out of that interaction pattern that tends to dominate the family.
But you were emphasizing too, Bill, that there's a lot going on in this family. I mean, in this excessive way. I mean, the mother, I don't know whether you heard that, but the mother reported that she'd been depressed for 20 years, which really must date very near the start of her marriage, and that she eventually got some help with that. And Bill was saying that she's been much more outspoken in the family, well, not much more, but more outspoken in the family and standing up for herself more than she had before. And that against this, powerful father constitutes a big deal. Mm-hmm. And then not only is the patient undergoing some kind of change, whatever it is, but also the next sibling has been more active in protesting than has been the case before. So that, and the father, Bill insists, is not iron. I mean, he's capable of listening at least somewhat.
Yeah.
And he didn't stamp out his wife's protest, for example. Apparently he was able to accept this to some extent, and he's willing to come for the family work. I mean, so this movement in this family, and it's not rapid, which is perhaps good. And it may be that that at this particular point, the oldest son is taking the lead in this change in the family. The mother having carried it for quite a while, maybe he's now taking the lead in it himself. But we have more experts on the family here, people more expert on the family than God knows I am. I don't know, but maybe you are too. But I hear there are some experts on the family. That's true or not? Yeah.
I don't know where they are. Actually, I would comment not on the family, but on having had two gone through sophomore year. I would say one of the developmental problems is surviving sophomore year. It's because
is this the same one that year two are in?
Yeah, I've got it. In fact, my daughter's in this class. And the trouble with the damn place is that they've given all the homework, and a lot of it's really boring. And so both of my teenagers said they hated sophomore year because they have the worst teachers in the 10th grade. And all they do is throw work at them. They think this is... And so I think both of my kids found the 10th grade the hardest to do. Because and I think what happens is that as the kind of character, Reich, said that, your character has certain successful aspects, but there's certain situations where a person's character will get them in trouble. And here's a man that's so successful at being able to force himself to do things. But the weakness of this character are situations where you just can't make yourself. So any situation in which it would be difficult to make yourself do it because it was boring or, it was just so much of it. Yeah. I think he's reached what most of us reach in medical school.
I give up a little bit.
Well, I can't make myself.
Yeah.
I can't shovel any more down my throat. And then, I think he's also discovering something that I discovered it at MIT really, and trying to do calculus there with all these characters. But that when you discover that when this man, I think he's a man already, when this man discovers that he doesn't do mathematics so well, I bet it really hit him really hard. Apart from all this other family stuff, I've seen that is a very big thing. I mean, he's talked about ascension, He uses this metaphor of ascension. Boy, when you discover, he's thought way ahead. When you discover you're not too good at mathematics in the 10th grade, I bet he actually discovered that. bet it really hit him very hard. Boy, it hit me hard, and, at MIT, I only got a B plus, with all these screws. So I would see that he'll get better by next year. I think he'll survive sophomore year, and he'll be a lot better in his junior year, and he'll finally probably be much better by the time he's a senior.
How's Bill going to get any credit for this case if you tell him that?
He doesn't want me to.
No, Swift and I are never competitive, never.
Nobody ever wants us to.
Well, didn't Osler say that the job of the physician is to amuse the patient until they recover from the illness?
Now there's a worthy statement from the doctor. Winnicott said something like that, and sometimes one has to hold the case and wait for developments, and that you're really doing something very important to like what Les was doing, and admiring him, and just letting time take its course. I think as long as he doesn't do something bad right now, he'll be all right.
I wonder too if he doesn't sometimes feel a little out of sorts in terms of his peers, in that he thinks about things. He's in a lot of ways more introspective, more sophisticated, and more sort of verbally, at a different level probably than a lot of his peers. And imagine that he has some friends and does pretty well in that arena, but sometimes he feels that there's a certain frivolity about the whole high school situation that, again, where he'll grow into, or they'll grow more into where he's at, and I doubt if he's going to go the other way and sort of get to be more spontaneous or more frivolous.
Oh, they may catch up with him.
Right,
that's right.
Yes. Right.
You'll have more company.
There won't be some of this disparity.
Yeah.
I was trying to imagine what might go on in the future with him. I mean, you can never predict it, but the one thing I could imagine is that he would see Bill for a long while, and he might make some changes in his family. I can imagine him checking in with you every few years all through college. I mean, just needing someone to hold on to that gives him some positive. In a way, his father may be able to let down some on how hard he is, but probably will never be able to come around to give him any kind of praise. And I think that's one thing a lot of young men really lack in this culture, is to have someone of the same sex admire them. Girls can get it through looks, and it's more okay to tell a girl she's pretty. Their moms are more likely to be able to sexual identify with them and give them praise. And I think that's one hard thing for men in this culture.
Yeah.
Well, I would emphasize something different. I would emphasize the elements of mystery. Because, however many people we see and however hard we try, most of what's there is in darkness. So, one of the phenomena that many of you know much more about than I do is the way in which children serve as examples to their parents to try to improve their parents' behavior. I'm much more impressed by that than the way parents try to improve their children's behavior by their behavior. Children are extraordinary centers of learning, potential centers of learning. And is all this somehow directed at his father, at a way of bringing his father and his mother closer together? Is he standing in a little bit for his mother's best? He could be doing a lot of this just for that reason, in my limited experience. But I don't say that's so. I just say it's shrouded in darkness.
There's a phrase that he used that actually alarmed me along those lines. And you were I don't know whether it was clear to everyone, but the way I thought you were working with him, you were probing possibilities with him, you were probing the edge of the suicide in the other kid. And he used a certain phrase which he said he punched his own ticket.
Punched his own ticket,
That was a very curious, speaking of the mother, you see what I mean? In other words, if we take seriously, it's sort of one of Salvini's favorite ideas that the kid that gets in trouble fights a battle on behalf of the parent who he thinks is losing. So if he thought his mother wasn't punching her own ticket, that would sort of give him a job, you see. I was a little alarmed by that. I thought, speaking of darkness, I thought something led off into darkness there, that there would be some danger that if he didn't punch his own ticket, he might, you see what I mean? for him, that was almost like a positive act. He punched his own ticket. You know, I mean,
It does sound positive.
it sounded like he did something. He made up. It was a statement. He made up his own mind. He didn't hand his ticket to the conductor, his father, right? He punched his own. And so I mean, I'm linking up the notion that the mother probably hasn't punched hers until recently, and in some way, I mean, one of the mysteries of the case is how he's going to do it.
Yeah. Well, it must be tremendous cognitive dissonance seeing his mother go in this other direction.
Mm-hmm.
I mean, and trying to hold on to both parents
Mm-hmm.
with her developing in a way that Dad
Mhm.
hasn't gotten onto very much yet.
Mm-hmm.
See, I would almost see him as seeing the father as the loser right now. Mom's starting to make some gains.
That could be. That's a good point.
I keep wondering, he identifies so strongly with the father being this achieving guy, and then, guys get something less attached to, guys get dragged down by women, they lose their ability to achieve and to get ahead in the world. And with mother starting to not be depressed and get ahead, is this kid somehow, well, for lack of better words, is he holding Dad's depression since Dad can't be depressed or reveal or anything?
Yeah.
And I see the struggle between Mom and Dad is big right now, and that worries me. Can they be helped to get to some different relationship that nobody's got to be depressed, and if they can that help that, you can achieve and you can be happy, more or less, and not be pulled down by this family or these other responsibilities.
A lot of interesting possibilities.
The other thing that made me wonder how secure he felt about his family was the fact that he put some of this money into a college fund, which I thought was sort of peculiar if his father's really as successful. What is he doing worrying about, is there going to be money for me to go to college? I mean, I thought that was a little bit...
Well, or does he have to do it on his own?
Yeah. Yeah, it's hard to know what that means, isn't it?
It was a significant addition to his college fund. He must have made a hell of a lot of money. God.
Was he friendly with the first or the second?
First, the black kid. I think they're on the football team together.
Yeah.
Yeah. Which is always a worry. Maybe it's depressed, and there was a friend who commits suicide with a teenager.
I have a question about your overall style. I mean, it seems like through the interviews that you don't really delve right in. You just kind of tiptoe around, and you're very subtle. And I wonder if that's because you're consulting and you're not following people regularly, or if that's something that you do, if that's your style. And if it is, I mean, if you could comment on why and how you feel about it.
Are you asking me if I agree with you that I'm subtle?
Well, you seem to be to me. I mean, maybe I'm really off the wall. I don't know.
Well, I appreciate it very much, your remark. Whether I can agree with it, I hope there's some truth in what you say, right? But it isn't different than what I usually do, if that's what you mean. It's not what I mean, different what I try to do. I really try to mind my own business. At 10:30, if any of you can stand the sight of my face any longer, you'll hear me discuss it. So try to be more systematic about what I think interviewing should be like.
Do you make a difference between interviewing and doing therapy with someone? Or do you...
No. No, I don't think so. Maybe I should, but I don't. I think of interviewing as providing an opportunity for something to happen. And as I'm going to say in a very, very short time, I try to take a representative sample, like a biopsy or a urinalysis, to use a less dignified paradigm. One wants representative data, so to speak. One would like to have a feeling for what goes on, not just what's set up. How you can set it up so that you're more or less escaping from what Harry Stack Sullivan called wonderful works of clinical fiction, which is the term he used to describe most histories, physical transactions. The basis of that being, of course, that people, are guarded in front of each other. The transaction is organized in such a way that a person is not likely to give you much that means anything on first acquaintance, maybe even on a long time. So how do you, another way I like to say is, how do you create a safe place where something might appear, right? Medicine had a terrible problem with this, as you know, for a very long time. How could you take representative tissue? What parts of the blood segments can you look at that will represent something more than breakdown products of the significant events occurring further up the food chain, so to speak? How do you do that? That's a big deal, especially when it comes to the central nervous system, which is so encased, with the exception of my friend in South End, which is so encased, guarded by what's called the blood-brain barrier. An interesting idea. And you get samples from that. Electrically, it constitutes a fascinating problem because it gives off a lot of static, EEGs and things like that. But it isn't like the heart, which has a beat, and you can follow the tone of the beat in a way that gives you very simple-minded but really representative data. While the EEG is a mess. Don't let anybody tell you different. I used to spend a lot of time worrying about EEGs, and they're a mess. A lot of superstition goes on in the interpretation of EEGs, in my opinion. So when the further you get in there, the harder it is to know what you're getting. And then when you get into the mind, which is in there somewhere too, I assume, or at least there's some relationship to it, then you work through all kinds of interfaces. And it's been much more simple. It was a little bit like reaching for something underwater. There's a refractive error. But also as you reach, you drive it away because of the medium. And we work through all kinds of media, mental and physical, arriving at what Jim calls reliable data. So that most of what we get is static. Try to tune a radio that is receiving a great many stations at the same time. You can make all kinds of metaphors for what it would be like. Which means that it's an extremely interesting problem. You see the same problem occurring in a very different world, but in a somewhat similar way when you try to follow the development of modern astronomy. And once upon a time, it really looked pretty clear. You looked up there, and there were those little specks, and at night they came out, and in the daytime they went away, and there was the moon, and that had quite a regular course, it turned out. And then they put up instruments to look at it, and lo and behold, there were more specks even than we saw, and there were more specks behind the specks. And then, of course, there's devices for picking up X-rays and all kinds of rays and things that are coming in. So that it is a mess. It is a mess. And you watch these poor astronomers trying to figure out what reliable data would be from the spiral nebulae. They really are. They don't know what they're doing most of the time, as far as I can tell. It seems to me we don't look out, we sort of look in. But the volume and complexity of the material that we're asked to deal with is perhaps comparable. It makes it extremely interesting. We don't talk about black holes yet, but I'm sure there must be things like that in the mind.
How about the death instinct?
The black hole.
The analogy to the black hole.
That's a good one.
But, it's like sitting, across from you there, I had a different image of what you were doing, which was that in hearing about the pathology sort of made me think of it, that there's a certain kind of palpation going on. You know, in other words, you know, when you palpate the abdomen, that's another one of those spaces, which is a dark space that, you know, there's some things in it, but, you know, finding things in there, you know, you go palpation, you touch something, and then, you know, and then you know, and see if there's a little rebound tenderness, you know, I mean, I think you were percussing and you were finding some rebound tenderness in places. I think, for instance, when you know, the issue of being accepted, you know, you got rebound tenderness about this other kid who wasn't really, who wanted to be accepted. And you got a different kind of resonance when you mentioned earth movers. All of a sudden, 3 generations opened up. I mean, it was wonderful. I mean, all of a sudden, a space opened there. So I think, you know, it's like, you know, when you're palpating the abdomen, all of a sudden, things open up to you. You know, and you're emphasizing the static. I mean, we're just having our usual discussion, right? Havens is always saying how hard things are, and I'm saying, oh, come on. Come on, you're too modest. I mean, because your palpations there did open up spaces. But then, of course, you could say rightly, then the static closes in again.
But, you know, if you just...
But one gets these little epiphanies, I think, in this method of palpation.
I think that's right, as long as you see that they're only little epiphanies.
Yeah, yeah.
I mean,
Yeah.
Another one for me was the opportunity he spontaneously brought up the suicide issue, which the fact that it appeared near the end of the interview and he wanted to talk about it, I think speaks to the level of, that there is significant misery in him. It's not, he can sympathize to some extent with what his friend did. It's not beyond the realm of possibility. He punched his own ticket. And he doesn't, you know, he's so controlled, you don't see the misery on the surface, but I think his wanting to talk about that tells you he feels lonely. And
well, I don't know what your adolescents were like, but mine was so goddamn miserable. I mean, one of the reasons that I can enjoy old age or whatever period of life I'm in is that I'm not in adolescence anymore.
Good thing about doing it at once.
So awful, and I met a lot of people that resonate to that. I think it's an extremely hard time, and I mean, I admired so much that he could do so much in the midst of whatever it is he suffered. Such a gallant and splendid young man. I thought it was such a dark time. And, you know, a lot of people always kill themselves at that time of life. Well, I considered it. I gave it considerable thought. And never got around to doing much about it, but then I've never been terribly active anyway.
All right, well, gallant, I think it's a real good word for this kid, isn't it? It gives him credit, which is where we ought to stop.
Yeah.
Okay, see you all at 10:30, I hope.
Okay.